Welcome to the Care to Share podcast, brought to you by Woodland Care, a luxury care home provider in the southeast of England. I'm Rachel. Each episode I will be joined by guests to talk about what you need to know when moving a loved one into a care home. We will give you practical advice and also show you what life is like inside our care homes to show you the truly positive side of elderly care. Hi everyone and welcome back to the Care to Share podcast. Today we're going to talk about end-of-life care with Maryum Ahmad from our Woodland Grove Care Home in Loughton. Maryum is the Deputy Manager there. Before working in health and social care, Maryum worked in the NHS and is a qualified biomedical scientist and specialised in blood transfusion. Her first role in health and social care was at a small residential care home for the elderly, where she joined as a Deputy Manager and then as a registered manager. Since then, she's been in various management roles, today we're going to talk about end-of-life care. So welcome, Maryum.
Thank you very much.
Thanks for joining us today.
It's my pleasure to be here.
Right. Did you just want to start by giving a bit more of an introduction and a background on yourself?
So I think you've covered most of it, but I joined Woodland Care in 2020. It was during the pandemic. I remember on my third day in my role, the country went into lockdown, so I had to shield for 3 months. So I came back to my role in June 2020. I joined as a memory flow unit manager. I did that for around a year. During this time, we enrolled onto GSF Gold Standard Framework accreditation. So we started that off. And after about a year of managing the memory flow, I took on the role of head of residential and memory care. Did that for another 12 months. And now I'm working as the deputy and the end-of-life lead for Woodland Grove.
Great, thank you. That must have been an interesting time to join then, right at the start of lockdown. So were you not able to go into the home for the first 3 months?
No, but I think third day I was asked to go home because I was high risk. So
right, okay.
I was shielding for 3 months, but
okay.
I called in every day. So it was quite a different experience where, you're staying at home, getting to know your team. And it was just, everything was very different from how it normally is, joining a new role, joining a new home, managing a new team. It was very different.
Yeah, definitely. Yeah. So you mentioned the Gold Standards Framework and your role as the lead of end-of-life care at Woodland Grove. Could you explain a little bit about the Gold Standard Framework and what your role involves as lead of end-of-life care? And then we can talk about end-of-life care as a subject.
Yeah, so the Gold Standard Framework is a charity. It's the leading end-of-life care provider charity for care homes. It's been running for the last 25 years. What they do is basically they train all frontline staff to make sure they bring them up to a standard where they're able to provide gold standard of care. It is end-of-life care accreditation, but the way they run is in a way that they train people to start providing proactive, good standard of care before death even kicks in. So anyone that moves into a care home gets classified, gets put into a category which identifies what stage they're at. So when you're being, you use the proactive guidance to identify what category people are in. You can be blue, green, amber, and red. And based on that, we develop their care plans and we make sure that they're getting the right support at the right time, at the right place. And it is a multidisciplinary approach where it's not that we're working on our own. We're working with the MDT team. We have the hospice, the GP, the TBNs, the hospital team, everyone working towards one main goal to make sure that people that are heading towards the end of life get the best possible care. So the approach of personalized care.
Okay.
Can I just ask, so do we accept residents who are on that pathway, or do you just deal with residents that are already in our care that then we provide end of life?
We do accept residents that are on that pathway. The good thing about GSF is that most of the hospitals are going through the accreditation. So when they call us with a referral and they say the person is on palliative care, we ask for what coding they're on.
Right.
So they would say green, yeah. And based on that, we can already establish what sort of care they need. And then we do our own assessment, put everything in place, and then the residents get brought in. But there are some people that move to us from their homes that have never had this. So their GSF accreditation, their GSF staging starts from when they move in with us.
Okay. So you say most of the hospitals are moving towards GS, the gold standards framework.
We had we passed Woodland Grove passed their accreditation a couple of months ago, and when we went to the awarding ceremony, most of our local hospitals and the wards were going through the accreditation at the same time. So it's good to know that.
And do you know what
in place as we do?
Yeah, definitely. And do you know what percentage of care homes have the accreditation? Are we in the minority?
Most of them, I don't know the exact precise percentage, but most care homes are going for the accreditation at the moment, because when families move their loved ones into a care home, most of the time it is for permanent stay. You know, that we do get people, we do get residents that come in for a couple of weeks for respite stay, but most of our residents are permanent, and families do know that this is where they will stay until their final days. So that's why most homes at the moment are focusing on going for the GSF accreditation.
Okay. So thank you for explaining that. That's really good to know about the accreditation and the benefits that it has for us to have that. So can you talk a bit more about end-of-life care in general, why it's such an important topic for us to cover? And obviously it is a difficult one to talk about. It's not a topic that everybody wants to talk or listen about, but why it is important to have the conversation about end-of-life care.
You're correct in saying it is one of the most difficult discussions to have. But it is, I think, one of the most important ones that we need to have with our loved ones, with our parents, grandparents, as they get older, as they get ready to especially move into a care home. It's important because every individual lives their life how they want to live it. But towards the end of it, there might be a chance that they're unable to, at that time, tell us what their wishes are. So if their wishes and their choices are discussed while they're able to discuss it, then everyone around them is able to provide the care they would have liked towards the end of their life. It's if we know if everyone around the resident knows what they want done, providing care, personalized care, becomes a lot easier, and it's a lot more personalized, which in turn is better for the family, the friends, and most importantly, the residents. But we have had residents where they're on palliative care, they're on a red, and nothing has been discussed with them. And it becomes a little bit more difficult to make a best interest decision involving their family, friends, and the MDT team. And although everyone tries to make a decision in their best interest, but in the back of your head, you always think, is this what they would have wanted? So for me and for everyone at Woodland Grove, talking about end-of-life care and end-of-life wishes is something that starts after the first week. And it's not a discussion about dying, it's a discussion about living. How would you like to live, towards the end, towards your final days? So it's your approach to the discussion, I think.
Yeah, I was going to ask, when do you have that conversation? Is it the same for every resident, like you say, a week after, or when they move in? It's like, when is the right time to have that conversation and to bring that up with a loved one? No.
Yeah, there is no right time. There is no set time for any residents. We need to get to know the resident a little bit more. What happens is before we accept a resident, we go out and we do a pre-admission assessment. So it kind of starts at that stage where we find out what their needs are, where they are on the staging, and depending on that, we have the discussion. Some people come in and they have a whole script, they have a whole detailed document prepared of what they would like, what they wouldn't like, whereas others don't want to talk about it at all. Families don't want to talk about it. So it can be very difficult at times where family members are very sensitive to the discussion, but we do try to do it in a way where everyone's comfortable about talking about it and everyone's happy about talking about it. We don't want to put families or residents in a state where they feel anxious or they feel worried. So it's different for everyone, but ideally, as part of our care planning, we start it within a week or 2 weeks of admission, but in a very subtle way.
Yeah, that was my next question. What would that conversation look like in terms of what do you discuss, as in, how do you have that conversation? And what if somebody was moving into a care home or they're in this situation, what are the important points to cover?
Well, the first thing to cover is to find out how long they're with us, and that whether they're respite, whether they're 2 weeks, 4 weeks, or if they're permanent. If they're permanent, then we start off by talking about their life history. That gives us quite a clear indication of who the person is, what their likes and dislikes are. We start working on the care plan with the resident, with the family, with the friends. And then from there onwards, we have a discussion about their needs, their medical diagnosis, and what their wishes are. So I think their medical diagnosis is a huge part of the discussion, because then that leads on to, if scenario A happens, what are your wishes? Would you like to be hospitalized? Would you like to stay with us? We work very closely with the GP. So at times, before we have the discussion with the GP, before we have a discussion with the family, we've already discussed everything with the GP. And then we have that discussion with the family with an input from the GP. And families know that we're here to look after their loved ones. So most of the times they do rely on us for guidance. It's just an integrated approach of working with everyone around us in the best interest of the residents. And most of the times, the families are very appreciative of that, and they understand what we're doing. And if the families are kept informed, then they feel they know what the next steps are. We do have a lot of GSF leaflets and handouts that we give at each stage. So it's about educating the families and the friends as well. And that has helped us a great deal, because I see the difference between how we were prior to our accreditation and how we are now, and while we were working towards it. So everything is staged, and all the team members are trained for each stage, and they know how to speak to the family members, friends, in a way that we are comforting them, reassuring them, and keeping anxiety levels very low.
No, that's really good.
I was going to say, I was quite curious in terms of how you work with the multidisciplinary teams. I didn't realise that that would play a part for the resident just kind of moving in. How do you liaise with the multidisciplinary team? How does that kind of play into it? Because that's quite a lot of different people. As you said, it's kind of like that integrated approach. How does that work? Just to kind of give a bit of a broader picture on that.
So all the residents have a review with the GP. Depending on the stage that they're at, the meetings can be monthly. If they're on amber, the meetings are weekly. And if they are on red, then the meetings are every 24 to 48 hours.
Yeah.
So it's very structured.
It's very structured, and that structure comes with the GSF accreditation.
Yeah.
Right.
Yeah. So if they are on amber, I'll talk about amber. If they're on amber, then we have a meeting on a weekly basis. And depending on, in that meeting, we have the care home, Woodland Grove, we have the family members, we have the GP, and we have the hospice team involved. We work very closely with St. Clair's Hospice.
Yeah.
Right, okay.
And in addition, if there are any other healthcare professionals involved, for example, the TVN or the district nurses, then they join in as well.
Okay.
Right.
We have video consultations for anybody that's on amber or on red. But we have a very good working relationship with our GPs. We work very closely with 3 of our local surgeries. And all we need to do is give them a call and let them know we would like a video consultation. And to date, they have never let us down. They will call within 20 to 30 minutes with a video consultation, or they will come in. So GSF accreditation has worked for us because we have a good working relationship with everyone around us that has an input in the well-being of our residents.
That's a really good, good demonstration of, as you said, that kind of personalised care. You know, that patient really is receiving care that's tailored to them, and how kind of reassuring that is for the families as well.
Yeah,
You know,
that's what I was going to say.
you know,
the reassurance.
You know, that they are their loved one at, you know, such a difficult stage of their life is still receiving or is receiving, you know, the best possible care for them. And, you know, that I could just imagine that could bring so much peace, I guess, to families and their and loved ones. That's
It
really
does.
good.
It's never really easy putting your parents in a care home.
Yeah, absolutely.
No.
It's a huge decision. It's like, and the families put our trust in us because we're looking after them 24/7.
Yeah.
Trust is a big part of it, isn't it?
Yeah, it is. It's very rewarding at the same time. It's not easy. You only get one chance at it. So we need to make sure
Get it right.
that we get it right.
Yeah, absolutely.
And
So
the only way to get it right is to proactively keep everyone involved and identify what stage they're at.
Yeah. So can you talk a little bit about, so when a resident does sadly get to that stage where you know it's imminent, so for the resident and the family, I know you've spoken about being at the red stage, but what the final days look like, any medication that might be involved, and I guess ultimately the process of dying in a care home. Can you talk about how you make sure the resident is as comfortable as possible, as pain-free as possible?
Yeah. So once the resident moves into the red stage, like I previously mentioned, the GP video calls every day or every other day. Our priority at that stage is ensure that the resident remains comfortable and pain-free. Mostly when they are at the red stage, they have stopped taking most of their medication. The only medication that we administer at that age is the end-of-life medication to keep them pain-free and to keep them comfortable. We take into account their end-of-life wishes to make sure that we're doing everything that they asked for. Some people like to have flowers next to their bedside. Others want to have photos of their family, their grandchildren next to them. Some people want a certain sort of music playing. So towards the end, it's just about that person and what they've wanted and how we can go over and beyond to meet those wishes. It's also about supporting the family members towards the end. Sometimes it takes 2 to 3 days where we think these are the final days. Family members stay with their loved ones We offer them accommodation, we offer them meals. So there's a lot of movement in and out of the home as visitors. This care staff need to be looked after at that stage as well, because no matter how many times they go through it, every single time it's upsetting for them, because this is someone they've looked after for weeks, months, years. So towards the end, it's a very subtle, quiet, and it has to be a comforting process for the family and the resident. And we have had very dedicated carers who have sat with the residents if the residents don't have family members. So the input from the MDT team goes up when someone's on red. The hospice team actually comes in to visit our residents when they're on red. Because the end-of-life care that we provide here at Woodland Grove is the same as what's provided at the hospice. So there are times when family members want their relatives to be moved into the hospice because they think there might be better care at the hospice. But then we have the doctors coming in from the hospice to have a discussion with the family to let them know that there's nothing different that they would do at the hospice that we can't do at the home. And I think that's a huge compliment, because last thing we'd want as a care home is for the residents to be moved into a hospice towards the end of life. And GSF accreditation reassures our family members that we can do anything that a hospice can do for them. So it works for us because we can look after the resident. It works for the family members. And most importantly, it works for the resident because they don't need to be moved right towards the end of it, because that's not a nice thing.
No, it's not at all. No, thank you for talking about that. So how once a resident has passed, how do you support staff and also the families as well? Does the framework have any kind of guidelines on that, or is that just something that I know you do already? But how would you do that?
So the good thing about GSF is it doesn't end. The process of GSF staging doesn't end when the resident passes away. Once the resident has passed away on a red, their profile then moves to a purple. Okay. Purple is aftercare. So aftercare involves looking after the family members, supporting them with whatever support they need, really, because as much as we think we can prepare the family and we can support the family for what is inevitable, but when the resident actually passes away, running high, but then at the same time, a lot of paperwork has to be done at times. So we are there to support them through the whole journey. It's sometimes very difficult for the family members to go through that whole process on their own. So the care team, the management of Woodland Grove are there to support them. We give them an Oakland Care bereavement leaflet. It has all the useful numbers. We make sure we give them regular calls. If need be, we help them arrange the funeral. Care staff are very proactive in Woodland Grove to attend the funeral. They go in their own times sometimes, and that just goes to show that we live up to our Oakland Care values. We are one family. We are there for them right until the end to pay our respects.
I think that really, you're right. I think that does really align to our, as you just said, our core values, where, residents and their families are like family to us. And you're right, it just doesn't stop when that person passes away. That continued support, that continued care just really shows how much we really do value residents and their families, even after their loved one has passed away. And I think that's a real that's a real good attribute or a good value that we do have.
Like for example, with Christmas coming up now, I've got a list of all the residents who passed away this year, and anyone that has a husband or a wife that are on their own. We will give them a call, see how they're doing, send them a Christmas card, see what their plans for Christmas are, and we check up on them, and that is very much appreciated by the family.
I'm sure they really appreciate that thought. That's lovely. That's lovely to hear. No, thank you for talking about that so gently, and it's I definitely have learned a lot from listening to all of that. You said it's a very rewarding role that you have, although obviously very difficult. Can you tell us a little bit about what you've learned from your role as end of life lead? How has it kind of impacted your view on life or your view on death?
So when I joined Auckland Care, my previous experiences were in management roles, but they were all from residential services.
Yeah.
So what mostly happens in residential services is that when the resident is towards the end of their life, because there are no nurses around, mostly they get moved to hospice, to the local hospice.
Right.
So moving to Auckland Care, a nursing home, was slightly different for me. And one of the things that I raised in my first probation reviews was that I would like very thorough end-of-life care training.
Okay.
And that's why I got put forward for the GSF accreditation. It took us 2 years to get the accreditation, but it's completely changed the way I look at death now.
Yeah.
I'm able to talk about it more openly. I have the team and I have accepted that it's a process, it's inevitable. We can't run away from it. Because we can't run away from it, we've got to make the most of it, and we've got to get it right, that one chance that we do get. It has affected my personal life a lot as well, because I have had deaths in the family, but I look at them differently now.
Okay.
It's a transition, and everyone, and it's about the person who is going to go through that death process. So everyone around them is their support system.
Yeah.
The support system must remain supportive, calm, caring, and compassionate.
Yeah.
And only then I feel you can make it, I wouldn't say an experience, but a journey that was positive.
Yeah, like you say, a transition. That's what it is.
Yeah. It is a transition. It's a very... it's a topic that people don't like to talk about. I mean, even in my family, no matter how old someone's getting, sometimes, if you bring it up, it's like, oh no, don't say that,
Yeah.
It's like, no, but someone's getting old. We need to talk about it. So I do that more now, even on a personal level.
Yeah, I think there's a lot to be learnt from that, because like you say, it's a topic people don't want to talk about, but it is inevitable for every person. So in my opinion, better to talk about it and make it, like you say, that person as supported, and make the transition as smooth as possible is obviously going to be better, isn't it? So I really appreciate you talking about that. Like I say, covered a lot of really interesting points there, but it's very eye-opening, and I hope that conversation, if anybody is in the situation where someone is old or someone is coming to their end of their life, that if they can listen to this, it can help them. So Tasha, I don't know if you want to add anything, but I know that Maryum, you've got some numbers that can help if anyone is grieving or looking for support.
So we've got the National Bereavement Support line that anybody could call. I think they're one of the top ones. And another one that I really recommend to everybody, it's the Good Grief Trust.
Okay.
And any local hospice around you, even Age UK, they're very proactive in supporting families up to even after the resident has passed away. And for Auckland Care, we support our team members, we support the family for as long as we possibly can. But I think it's a discussion that is difficult to have, but we should all have it while we're young. That's it from me. Thank you.
That's it. Okay. No, thank you so much, Maryum.
That's right.
Yeah.
Thank you very much for your time.
Bye. for listening to the Care to Share podcast. We hope you found the information in this episode useful. You can find out more about Oakland Care at www.oaklandcare.com. You can also follow the Care to Share podcast on Instagram at care2share_podcast. Please also remember to rate and review the podcast.